Welcome to The Explainer. You know, we love to take these big, sometimes complicated topics and just make them make sense. Today, we're going to tackle a big one, demystifying the world of contraception and creating a simple map to help you navigate your options.
So let's just get right to it. The big question that probably brought you here is, with literally dozens of choices out there, how in the world do you even begin to pick one? It can feel, well, pretty overwhelming.
And, you know, the stakes are really high. This isn't just about a personal decision, though of course it is. Family planning has these huge ripple effects, impacting everything from our individual health and quality of life to the stability of entire communities around the globe.
Okay, so to get a handle on all of this, we're not going to just throw a giant list of every single option at you. Instead, we're going to build a framework, a way to think about it all based on the single most common question people ask: how well does it actually work?
And here it is. This is going to be our roadmap for this whole explainer, the tiers of effectiveness. We've got tier 1 at the very top, the most effective methods, where fewer than 1 woman out of 100 would get pregnant in a year. And it goes all the way down to tier 4 at the bottom. This is going to make everything so much clearer.
So where do we start? Well, believe it or not, we're going to start at the bottom with tier 4. Why? Because to understand what effective really means, we first need a baseline for what least effective looks like in the real world.
And what's down here in Tier 4? We're talking about methods that require you to do something with perfect timing, every single time. The big ones here are the withdrawal method, pulling out, and spermicides.
And this number really tells the story. With what's called typical use, which is how real people use methods, not in a perfect lab, a whopping 22 out of 100 couples using withdrawal would get pregnant within a year. Think about that. That's almost a 1 in 4 chance. And that gives us our baseline.
Okay, let's climb the ladder a bit to Tier 3. Now, this tier has some of the methods you've probably heard of the most, and it's the perfect place to introduce a really important idea for understanding all these numbers.
And that idea is the huge difference between perfect use and typical use. Perfect use is exactly what it sounds like, following the rules to the letter every time, no exceptions. But typical use, well, that's reality. That's how we actually use things with the occasional mistake or slip-up.
So what are we talking about in tier 3? Well, you've got your barrier methods like condoms and diaphragms that physically block things. And you've also got the daily hormonal methods, like the classic birth control pill and the progestin-only mini pill.
The male condom is a perfect example of this gap. If you use it perfectly, the failure rate is just 2%. But in the real world, with typical use, that number jumps all the way up to 13%. That's a massive leap, and it all comes down to plain old human error.
So let's keep climbing up to Tier 2. This is where we find a whole category of methods that are designed to pretty much eliminate that human error problem. They're called LARCs, or long-acting reversible contraceptives. Just think of them as the set-it-and-forget-it options.
The reason these are so incredibly effective is simple. They take you out of the daily equation. There's nothing you have to remember to do every day or every time. They just work, all on their own, for months or even for years.
So what are we talking about here? The most well-known LARCs are IUDs, intrauterine devices. They're these little T-shaped things that a doctor places in the uterus. And they come in 2 main flavors. You've got the non-hormonal copper IUD, and then you have the hormonal IUD, or IUS.
Okay, I know what you're thinking. Looking at a diagram of the insertion can seem a little intense, but it's actually a really quick procedure, done right in a doctor's office. And the payoff is huge. Once it's in, you're looking at 3 to 10 years of super effective protection.
And the trade-offs are pretty clear. On the one hand, you get this amazing long-term and totally reversible protection. But on the other hand, it does require a clinical procedure, and it can come with side effects like cramping or changes in bleeding patterns.
All right, we've made it to the top. Tier 1. These are, hands down, the most effective forms of contraception available. The key thing to know about this tier: these methods are considered permanent.
So what's in this tier? Sterilization. For women, that's tubal ligation. You might know it as getting your tubes tied. For men, it's a vasectomy. They're both surgical procedures, and as you can see from the numbers, a vasectomy is actually just a tiny bit more effective.
Now check this out. This is pretty fascinating. If you look at the entire world, what do you think the most common form of contraception is for women aged 15 to 49? It's not the pill, it's not the condom, it's female sterilization. Almost a quarter of women. It really speaks to the desire for a one-and-done, permanent solution in many parts of the world. Okay, so we've climbed the whole ladder, from Tier 4 all the way to Tier 1. We've talked a lot about effectiveness, but here's the thing. That one number, it's just one piece of a much, much bigger and way more personal puzzle.
And I think this quote from our source material really just nails it. There's no single method that's perfect for everyone. There just isn't. The most important thing is that you have the freedom and the information to choose what's right for you.
Because it's not just about the failure rate, right? You got to think about your own health, your lifestyle, your relationships. What about convenience and cost, potential side effects? And, this is a big one, do you think you might want kids down the road?
And what you should really take away from all this is that this field is constantly changing. I mean, researchers are working on some incredible new tech, like a remote-controlled microchip implant that could provide contraception for up to 16 years. The options of the future will be even more personalized.
And that leaves us with this final thought. As technology advances, the central question shifts from just what works to what works best for me. The choice is becoming more personalized than ever, and that is a pretty empowering place to be.